Well, as you know, this new year brings a number of changes when it comes to health care laws, and you may be wondering what that means for your children, for Medicare, and of course for your bank account. Insurance advisor Craig Gussin joins us in studio to break this all down for us. And Craig and I spent about half an hour on the phone yesterday trying to break this down so we can make it understandable for the viewers. And let's go straight to how this will affect children in the new year.
Children are the biggest one because under the health care reform bill that was signed on March 23rd, it said that you got to cover kids and also pre-existing conditions. And by the time the interpretation got done between the insurance companies and Congress, almost every insurance company around the country stopped rating children September 17th.
Because they knew that these expenses were going to pop up coming January 1st.
And they had to redo the plan to make it affordable. So January 1st, insurance companies in California have to offer health insurance to all children under age 19, guaranteed issue regardless of their health conditions.
Okay.
If you have an unhealthy child, they can raise the rates 100% of what the normal cost is.
If you have a healthy child, they can raise the rates 100%.
Unhealthy.
Unhealthy child. Unhealthy child. Okay.
But for a normal one, it's going to be whatever the standard rate is. The product is just coming out. I really haven't seen the cost. I have to expect it's going to be expensive because, as I was just telling you, the cost for preventative care for children, especially, let's say, a baby who's just born in the first year, is about $4,000 for checkups and all the shots that they need to get. And that is all going to be free under preventative care. So someone's got to pay for it.
We're going to make it up on the back end.
We're going to make it up on the back end.
Okay.
So that's one of the things. But if an insurance company doesn't offer health insurance to kids, they can't do business on. They can't write individual health insurance for 5 years in California.
Interesting. So they're going to pay a penalty if they don't do this.
So all insurance companies are going to have to do it.
Have to do it. Let's jump ahead to health savings accounts and flexible spending accounts for those people who may have an individual plan.
Right. What happened was up to today, if you go in and you want to get aspirin, Tylenol, or any type of over-the-counter prescription, you can use your health savings account money to pay for it. January 1st, it's going to change. The only way that you can have a over-the-counter drug covered is to have prescription for it.
So you need to get your doctor to write that prescription.
Right. Even if it's for like an allergy medication such as Claritin.
Okay.
You can get that, and even though you have the prescription, then you can go and you can use your health savings account to do it. It won't affect insulin, it won't affect crutches, but it is going to affect a lot of the over-the-counter drugs that people are using now.
Okay, so also we want to talk about Medicare's prescription and the rebates that are coming along with this. And for some, this may actually be of help for a lot of elderly
folks. It's going to be a good thing because in 2008, 3.4 million people met the donut hole. January 1st this year, it's going to be $2,840. So if you're over 65, you're a senior, you're on Medicare, and you have your prescriptions, if you hit $2,840 in prescriptions
out of pocket,
from that point on, you have to pay 100% of it.
Okay.
So what happened was brand name prescriptions are going to be subsidized 50%, and generic prescriptions are going to be subsidized about 7%. Doesn't sound like a lot, but I saw an ad 2 weeks ago talking about $2 prescriptions for generic for a 30-day supply. So it's really going to come down on cost.
Yeah, exactly. And these are folks who use medication on a daily basis, and they certainly need the help. So this will be good news for those
They really do. I mean, that's one of the big things. The other thing that you want to know is that seniors, once they hit the $2,840 out of pocket, will get a check from the government for $250.
Okay. Good to know. And we are out of time, but I know that a lot of our viewers may be feeling the same way I do, that some of this is so confusing and you may have specific questions. So if you're one of those and you do have some specific questions, just go to our website, sandiego6.com, click on Hot Topics. We will get you in touch with Craig over here, and he will help you answer some of those questions and break it down for you.